There are several ways that you can get a CSF leak, a cerebral spinal fluid leak, but let's talk about some of the more common ways. Number one, a CSF leak can come from a lumbar puncture. Maybe you got a lumbar puncture to be tested for an infection, or maybe you had a lumbar puncture because you got an epidural during labor. A lot of times these puncture sites don't close and heal on their own, despite what some doctors may tell you. And even tell you the number of moms that I've talked to over the last few years that either had a CSF leak or still have a CSF leak caused by the puncture that was made for their epidural. I hear from a lot of these moms that they noticed symptoms right after giving birth, but that they couldn't tell if it was from having a baby. They go home and these symptoms become exacerbated over the following days, weeks, months. And when they return to their doctor and discuss their symptoms, it's often played up to the fact that they just had a baby, that they're a new mom. Maybe they're stressed, maybe their hormones are rebalancing, maybe it's because of the lack of sleep, maybe it's because of postpartum depression. As a mom, you feel like you're losing your mind, and the saddest part is the precious, precious time lost with your child. This happened to Olivia Newton-John for over 5 years. She talks about it in her biography. It also happened to me. Outside of epidurals, as I mentioned earlier, the lumbar punctures can also take place due to certain testing. I know when our 9-year-old son was in the hospital, he had to have a lumbar puncture done to be tested for West Nile virus. Moving on, patients with connective tissue disorder like Ehlers-Danlos syndrome or Marfan's are more prone to cerebral spinal fluid leaks. The reason being is that your spine is made out of connective tissue, and so if you have a connective tissue disorder, your connective tissue is already compromised. This makes you more prone to CSF leaks in many situations, one being the first example I shared about lumbar punctures. If you have a lumbar puncture and you have a connective tissue disorder, it is even more likely that the puncture will not heal on its own. And you may think, well, I don't have a connective tissue disorder, but I thought that too. I had all the telltale signs and symptoms, but no one ever diagnosed me until a few years ago when I found myself in front of a geneticist at the Mayo Clinic. At that visit, I learned that Ehlers-Danlos syndrome is genetic, and so we had our youngest son tested because he was also displaying all of the signs and symptoms, and he was also diagnosed with hypermobility Ehlers-Danlos syndrome. Okay, let's cut it here and go to the next video and talk about even more ways that you can get a cerebral spinal fluid leak.